This is video. This is video number one from my nutrition class, Nutrition 300. This will be the first video set that I've done for my combined diabetes and heart disease lecture. Di- um, Heart disease is considered the number one killer of people, except during COVID in the United States. But historically, heart disease has killed more people than diseases in war combined. Cancer is like number two. Diabetes, though, is not it's not what goes on the toe tag when somebody passes away, but it is a sneaky disease that does contribute to a lot of disease, a lot of illness, which we call morbidity, and also death, mortality. There's two kinds of diabetes. Historically, before humans started gaining a lot of weight, most folks who had diabetes, if they were younger, they had type 1. It's an autoimmune disease. It runs in the family. Typically, you see it in kids. Type 1 diabetes used to be called juvenile diabetes. Now, it's not called that as much. So what happens in that instance, the body attacks its own pancreas and stops the cells that make insulin. And so in that instance, if you are diagnosed as type 1 diabetic, you will have to take exogenous insulin, a shot of insulin daily, multiple times during the day. There's different kinds of insulin, or a pump, etc. Type 2 diabetes is a little different. The pancreas still makes the insulin, but for a variety of reasons, it doesn't work as well. And I don't think anyone really knows. And I think when we get to obesity and we talk about gastric bypass surgery, where people have their stomach size reduced and within 2 to 4 days can have their diabetes go into remission, which means go away, and they haven't lost weight yet or a significant amount of weight yet, then the explanation for why weight is considered the major cause of type 2 diabetes is not clear. And we still say being overweight is the major cause of type 2 diabetes. But we also know as you get older, your ability to use insulin also decreases. What are the signs? Some of these you would not have with type 2 diabetes. With type 1 diabetes, if you're not making insulin, you're not storing glucose, correct? So that can get you into trouble because eventually you could pee some of that insulin out, and you could literally put yourself into ketosis, where the body thinks it doesn't have any glucose available because you're not making insulin and you can't store it for later. For type 2 diabetics, though, that's going to be an instance where there's lots of blood sugar floating around. It will eventually come down, but it can cause problems while it's elevated, and that can be foot pain because it's affecting your nerves. High blood sugar can affect your vision. If your blood sugar is running high, you will pee it out. Because you're peeing it out frequently, that would make you thirsty, right? So I think it's polyuria followed by polydipsia. You're urinating a lot, therefore you're thirsty a lot. But you can have type 2 diabetes and have none of these symptoms. So it really depends on how severe it is and where you are in the disease progression. When you talk about diabetes, it's really a blood sugar measurement disease. For a fasting blood draw, your physician would like to see your blood sugar run between 70 to, let's say, 100 milligrams per deciliter. Between 100 and 110, sometimes they worry about that, but really it's between 100 and 125 where they say, okay, you are heading towards at least type 2 diabetes, and we call you pre-diabetic. If it's greater than 126 milligrams per deciliter in a fasting subject, by diagnosis, that's diabetes. Okay. So, what do we know about disease prevalence? About 37 million Americans have diabetes, 10% of the population. It's not uniform, though. If you were to go by zip code, the poorest zip codes in America have the highest rates of diabetes. Because we know, I'm going to actually go back. Oh, I don't have that slide. Oh, I'm sorry. It's on our Canvas page. If you look at the U.S., the poorest zip codes have the highest rates of obesity, the highest rates of diabetes, the highest rates of heart disease. I'm going to guess the highest rates of smoking and the highest rates of cancer. It's not that having money doesn't make you sick, but there's a socio-demographic component to all of this. And sadly enough, The poorest people in America tend to be the most likely to be overweight and then end up with the highest risk of diabetes. 33% of Americans are pre-diabetic. That should freak you out if you're going into medicine. Because even if they do everything right, they stop whatever they're doing, but they don't lose a pound. So they're not diabetic, but they don't lose a pound. Everyone will get older. Even if America stops gaining weight, we all will get older. And eventually, at some point, your insulin will not work enough or due to age. Again, we take a fasting blood draw, and we're looking for it greater than 126. Typically for patients who have an inkling that there might be diabetes, or in pregnancy, when we're looking for pregnancy-related diabetes. They do this test called an oral glucose tolerance test. And it kind of works like this. You come in fasted, let's say an overnight fast, they take your blood sugar. They expect it to be a certain value, a little bit low. They provide you a sugary beverage like glucose water. Seriously, glucose water. And then, let's say at 1 hour, 2 hour, 4 hour, and 6 hour, they take a blood sugar measurement. And what we teach in class, of course, is if you're making insulin, if you're consuming glucose or carbohydrate, your blood sugar will go up and then it will come back down, right? It'll like peak like a mountain. If your glucose is not coming down, that there's some sort of resistance going on, that means either you're not making insulin, or it's not working very well. And in type 2 diabetes, the blood sugar will eventually come down. It just takes a lot longer, and it stays elevated for a lot longer. All right, we're going to end on that.